He Cooper.
Thank you, Madam Deputy Speaker, and thank you to the Honourable Member of South Devon for bringing this very important debate to the House this afternoon. Also, thank you to the members for sharing such very personal testimonies, as well as bringing the broader context. I think it really adds value to what this House brings to our national conversation. As a public health consultant, I would be remiss if I did not spend a couple of minutes just talking about reducing the risk of dementia before I get on to dementia care, because only about a third of adults in the UK think that it is actually possible to reduce their risk of dementia. And I'm sure these are all really familiar to everybody and to everybody listening, but we can actually, as professionals, as healthcare professionals, as politicians, encourage people of all ages and stages of life, particularly middle-aged adults, to be more physically active, eat healthily and maintain a healthy weight, drink less alcohol, stop smoking, very apt at the moment, be socially active. So many members have talked today about being socially active, and socially isolated older adults are nearly twice as likely to develop dementia within 15 years, and also to control diabetes and high blood pressure. And if this sounds familiar, it's because we talk about this in the cardiovascular realm as well. So we should be communicating loudly. What is good for the heart is good for dementia. So moving on to dementia care, I want to talk a little bit about Worthing West and what we're doing there, and it really relates to a lot of what's been said already, and then move on to the national picture to conclude. In Worthing West, we have 2,361 people living with the condition currently, and there is a charity in Worthing West called Guild Care, which is a not-for-profit care service for older people, people with dementia, and children and adults with learning difficulties. They provide care for 120 people with dementia in their homes and a further 100 in their respite service. And I think it's great that today, Madam Deputy Speaker, we have heard so much about respite service. It is so important to help people with dementia access support, care and activities that provide a healthy way of living. People visiting dementia day services experience stronger social ties, better mental health, have fewer GP visits, use less medication, sleep better, something we all need to do, and have more active, engaged minds. But we also know that respite is vital because behind each diagnosis, as we have heard today, stands an unpaid carer, often, whose careers and lives are put on hold while their own health quietly deteriorates as stress, sleep loss and isolation take their toll. And so inevitably, we see dementia rates rising. Recognising and investing in the value of respite has huge benefits. We've also heard about some innovative community care hubs across the country, and Guild Care in Worthing West are developing their own community hub to combat social isolation that provides integrated dementia care, diagnosis, support and a rich programme of activities that keep people healthy and living at home, an aspiration that we want for all of us, to live well and to stay at home for as long as possible. I think that our role in government is to ensure a more coordinated system building on best practice models such as those we've heard about today, including this one from Guild Care in Worthing West. We've also touched on training today, and I would just like to say that Guild Care do deliver in-house specialist dementia training to their staff in a bespoke programme they did develop with colleagues in the Bromley Dementia Hub, so shout out to Bromley. Good research-based staff training is essential to equip care professionals to deliver compassionate, person-centred support, as so many honourable members have said today. It's the bedrock of quality care that recognise... Oh, well.
Thank you for giving way. You mentioned the person-centred care in dementia. Do you agree that initiatives like Playlist for Life, which is based in my constituency, which uses meaningful music to reconnect people with dementia to their memories and their identity, should be more widely supported across the NHS?
I thank the honourable member for that intervention, and what an outstanding service that sounds. I know today actually there is a creative mental health all-party parliamentary group happening, and I think we do underestimate the benefits of exposure to all of us for the creative arts, but specifically for dementia. You're absolutely right. Thank you very much for raising that. So training is absolutely essential. Creative arts we've discussed. To conclude, I just want to talk about what that means nationally, and I just want to talk about a national social care service, a thing that I know the Minister is very well aware of. And I absolutely acknowledge that the Casey Commission is a vital step towards implementing a national care service. And the Darcy report and our recent work in the Health and Social Care Select Committee, some members of whom are here this afternoon, underlines what we all know, that we can't fix the NHS without fixing the broken social care system. The two are fundamentally interconnected, and we must not look at health or social care issues in isolation, including dementia. We must ensure that strategic plans build better integration and recognise that investment in social care is essential. It's essential to improve people's lives, moving from treatment to prevention of illness, something that has been mentioned and is absolutely pivotal for the NHS 10-year strategy, and to save the spiralling costs of the NHS of an ageing population. So I would just finally like to conclude with changing the narrative, and I think this has been touched on this afternoon, around sometimes in dementia we think about it as an illness that has no hope, and I think it's very important to look at people, and somebody has already said that 50% of us may well develop dementia in our lifetimes, and it's touched, I would say, pretty much everybody in this chamber's lives in some way or other. Care Talk recently published a comprehensive report on dementia, and like the report's authors, it's well worth reading. I would like to urge for this new narrative on dementia. The traditional narrative, as I said, surrounding dementia focuses on decline and inevitability. But, as I've already mentioned, around 40% of dementia cases might be attributable to risk factors that can be modified, and a 20% reduction in the risk factors per decade could reduce UK prevalence by 16%. Even by this year. So I'm advocating for policies which help people to live well, protecting them from illness, including dementia, and services that help people to live well with dementia, emphasising their strengths, as so many personal testimonies have already said, and supporting people and their families to better navigate the condition and contribute to their communities and across our society. Thank you.